Good afternoon, everyone. Welcome. My name is Raul Melendez, and this is MPA593 Professional Presentation for Public Administrators. For this presentation's Week 3 Multimedia Discussion Board Number 2, I will discuss homelessness in Riverside County as a critical social issue. For this agenda, I will discuss why I chose this issue, who it impacts, why it matters, and what available evidence or data is out there, as well as why public administrators and policymakers should continue to prioritize this issue. So the social issue of homelessness in Riverside is one of the most significant issues out there. We clearly see it in major cities. It is my focus is going to be in Riverside County, but I mean we could see it across Southern California or even statewide and nationwide as well. Homelessness reflects broader structural issues involving housing affordability, behavioral health access, coordinated services. So ultimately, my goal today is to explain why this issue deserves to continue public attention and system level policy intervention. The reason why I selected homelessness is because it truly connects to my professional and academic studies background in public administration during my previous work supporting enhanced care management populations through Riverside University Health System. I work closely with individuals who experience housing instability and homelessness, as this was one of the population of focus that I was able to serve homelessness. In my current role as a health navigator with Inland Empire Health Plan, I continue helping connect members to community-based resources and support systems, such as the community supports. Some examples we support with health navigation or housing deposit, initial deposits, or housing sustainability as well. Through these experiences, I've seen how housing stability affects a person's ability to manage healthcare needs and achieve long-term stability. So I think there's somewhat initiatives out there where it's important in order for someone to be healthy, you need a roof over your head. So it's just a foundation or a necessity at this point. So understanding why I chose this issue also requires recognizing the wide range of individuals and systems affected by homelessness. Those affected are vulnerable populations, including families, transitional age youth, veterans, seniors, students experiencing homelessness, individuals facing behavioral health challenges. It also impacts schools, healthcare systems, emergency response systems, and local governments. An example that I have is with schools, there's a federal protection such as the McKinney-Vento Homeless Assistance Act that helps ensure educational stability for students experiencing homelessness. However, homelessness creates challenges that extend far more beyond education. It places strains across multiple public systems. Beyond identifying those who are impacted, it is equally important to understand why this issue matters to the broader Riverside County community, as it directly affects public well-being, service delivery effectiveness, long-term community stability. Also, Riverside County addresses homelessness through housing and workforce solutions, which includes programs like homeless housing assistance and prevention, Project Home Key, encampment resolution funding. So California also adopted Housing First through California Welfare Institution Code Sections 8255 in 2016. This policy prioritized rapid placement into permanent housing, recognizing that stable housing is often the first step towards long-term recovery and stability. That's what I was also mentioning. The importance of having housing before even anyone else is able to consider or take care of their health at that point. So they're focusing on meeting basic needs and safety. So if homelessness goes unaddressed, the consequences become increasingly severe, such as worsening physical and behavioral health outcomes, repeated emergency room utilization, increased law enforcement contact, significantly higher public expenditures. So I've done a little bit of research where supportive housing improves long-term stability. As Garcia and colleagues 2024 emphasizes, early systems intervention produce longer-term outcomes for both individuals and communities while reducing downstream public system cost. This demonstrates that prevention is more effective than reactive crisis response. And these challenges are clearly reflected in the available county level data. According to Riverside County Office of Homeless Services, total homelessness increased from 3,725 individuals in 2023 to 3,990 individuals in 2025, representing an increase of approximately 7.1%. During the same period, unsheltered homelessness declined by 19%. This suggests that while housing pressures remain significant, coordinated interventions are improving placement outcomes. Though the trends show both ongoing challenges and measurable progress, the data clearly indicates that the issue demands continued public attention and policy focus. So public administrators and policymakers should care about homelessness directly, as it directly affects fiscal accountability, public resource allocation, long-term community stability. And so evidence-based housing first models continue to demonstrate positive long-term outcomes. Riverside County has made measurable progress, but yet continued system coordination remains necessary. So in conclusion, these findings point to a larger public administrative or administration responsibility. As a future public administrator, I believe addressing homelessness requires evidence-based leadership, cross-sector collaboration, long-term strategic planning. Homelessness is not simply an individual challenge. It is a system-level public issue that requires coordinated leadership, sustained investment, and long-term policy planning. Thank you so much for watching.